Hi folks, John Adamson, the Rehab and Documentation Guru. Sorry, doing a video while I'm driving. Anyway, I am going to talk about a case study today and kind of do some root cause analysis on it. Obviously, my thoughts are not infallible. You may have some different perspective, and if you have any commentary, feel free to comment, and perhaps you'll bring up some good stuff that might spark further videos. So today I went to see a lady who is aged. And when I say aged, I'm going to say above 85. I'm trying to be real careful about not being specific with any potential HIPAA violating issues. She's cognitively intact. She has pretty substantial kyphosis of her thoracic spine. She also recently had an episode of what appeared to be syncope, and she passed out, went to the emergency room. They evaluated her for it.
In 1 mile, turn left.
Now, she has a history of arthritis in one of her knees. She has no history of significant cardiac events, except she does have AFib, and she has hypertension. She's never had a stroke. She has normal coordination, both sides, both upper and lower extremity. She has strong grip. She has a strong voice. More on that later. She has nice warm feet with some thickening of the nails, but not terrible.
In 0.1 miles,
Sorry.
turn left.
Good capillary refill in her feet. She's on not too many meds, but she does have a med for her heart related to the high blood pressure. She has a medicine related to the AFib. And
Turn left.
she has a statin med. Now, I've done a video previously on statin meds and why I find them particularly problematic. Hold on one second. I'm going to try to cut off this volume. See if I can do that. Just cut it off. Sound off. There we go. Maybe that'll work. So anyway, so I'm evaluating her because she has syncopal episodes. She's been losing ability to move, but during her hospitalization, she developed back pain, left back pain. A therapist in the hospital detected a knot in her left lower spine, roughly around the quadratus lumborum area. And she has extreme pain when she tries to lie down or sit up, has to move like a log. If she sits too low, it bothers her, that type of thing. Now, I evaluate her and I find out that physical therapy obviously can be concerned about her balance, but guess what? Her balance is really pretty good. In fact, it's rather remarkable. With her eyes closed, with narrow stance, she stood perfectly still, without sway, easily for half a minute. She took balance perturbations that I did easily. Now, she's had falls, and when she said she had falls, it was usually her knee buckling or that one time when she had a syncopal episode. But that's it. So I'm suspecting the balance issue, because I tested all her systems of balance, and they look remarkably good for her age. I think it's her knee. But then she was also getting a little winded going around the room. And then, of course, she's got this back pain going on. Now, first thing I think of is, okay, if I reduce her back pain, I strengthen her knee, her leg surrounding her knee, she'll probably be better. And that's where I'll focus on as a PT. But I also am aware of the fact that this lady is cognitively intact. She's aged. She's aged. Pretty old. But sharp as a tack. Cognitively intact. Excellent, what I can see, vascularization of her lower extremities. Strong grip. No signs of neuropathy. In other words, what am I saying? I don't see any clinical signs of plaque buildup in her body. She's never had a heart attack or a stroke. Her relative risk, she has no diabetes, nothing. Her relative risk of heart attack and or stroke is, well, she's up there. She might have one, but it's relatively low. And she's not showing any signs of reduced vascularization to the areas that we would typically see with people that are having plaque buildup as a concern. So I can't help but open my mouth when it comes to statins, because even though she had a sudden onset of back pain, and it does seem to have an orthopedic component, there's no question that in a significant minority of patients, I think the estimate is around 20% plus, back pain can be a symptom of not handling a statin medicine well. So and she doesn't seem like she probably needs it. So I mentioned this to the daughter, because she's also had some weakness in her legs, and we're not fully sure of all the possible side effects of a statin in every single person. So I mentioned this to the daughter-in-law, who's got medical background. She's like, oh, okay, I'll definitely ask about that. So that's a significant issue that might help. So anyway, why am I bringing this up? Because it was an interesting case to me. I like getting to root cause analysis. So I can directly address some things, and then I indirectly address other things. The other thing she told me was she likes her bedside commode that she puts over her toilet because it reduces her strain on her back, but she's having trouble moving her bowels. So she wanted to get rid of it because she felt like if she was able to bend down more and make it easier, which is true. She's absolutely right. So I told her, why not have both? Why not have raised toilet height so you can get off safely and effectively without hurting your back, and be able to flex your hips? And so I mentioned to her the squatty potty, and she thought that was neat. And so her daughter-in-law is going to look into getting one of those for her, so she can open up that pelvic floor and pass fecal matter. So anyway, that's another thing we're looking at. The other thing I was looking at was TENS, and she's got no contraindications for the use of TENS, and her family's got one. I'm going to get orders from the doctor to trial one. If it works, great, we can get an order for that. And then I'm going to work on balance and strength. So with those things in mind, and also looking at the other avenues to helping her function better, which would include pharmacology, that's how I'm going to address her. So anyway, hope that might have been a little bit helpful, that discussion. You might have some thoughts, and I encourage you to voice them, because there's some things I thought about during the eval I have not mentioned on this video because it's getting too long. Take care, God bless, and have a great day.